my name is Lisa MacMillan. I'm a case manager here at BIDMC. The role of your case manager is to work with you and your care team to create your discharge plan for after your surgery. A typical length of hospital stay for a patient after having a total joint replacement is 2 to 3 days. The majority of patients are discharged home with home care. These services and sometimes the home care agency are determined by your health plan. For example, your plan may allow a certain amount of physical therapy visits or require a copay. Insurance coverage can vary for these services. On the day following your surgery, a physical therapist will evaluate you and make a recommendation for either discharge to your home with services or to an inpatient rehab facility. Your physical therapist will continue to work with you during your stay and evaluate your progress daily. Be sure to let your nurse or nurse case manager know if there is a particular home care agency you would like to use. However, keep in mind that your insurance plan may determine that choice. Your nurse will call in the home care referral. Typically, home physical therapy services start within 48 hours of discharge from the hospital and continue for about 3 times per week for 2 weeks. By week 3, you may be ready to start outpatient physical therapy. Speak with your home therapist about when you will be ready for outpatient therapy and make your appointment as soon as possible. You may make your appointment at one of the following locations: Beth Deaconess Medical Center, an outpatient rehab department within an alternative hospital, or at an outpatient physical therapy clinic. Some of these options may be closer to your home. A visiting nurse will be requested for patients if the need for one is identified. If you or your physician think you may require inpatient rehab after surgery, there are several options for this. When you're admitted to the hospital for surgery, please bring the names of 3 skilled nursing facilities you would prefer to go to upon discharge. Don't forget to check with your desired facilities to make sure they accept your insurance. If you need a list of facilities, contact the Case Management Department at 617-632-0217 prior to your surgery. If you think you may need placement upon discharge from the hospital, you're encouraged to research and visit facilities prior to your surgery. Many skilled nursing facilities are willing to reserve a room for you on your anticipated date of discharge from the hospital. You should anticipate a 7 to 10 day stay at the facility. If a bed is not available at your first choice facility on the day you have been medically cleared for discharge, you may be discharged to an alternate facility. Occasionally, a patient may require an acute rehab hospital stay. However, these facilities typically only accept patients that have undergone a bilateral joint replacement. That means having both knees or both hips replaced during the same hospital stay. Patients with single joint replacements may be considered for an acute rehab hospital if they also have a medical condition such as Parkinson's or MS that may impact their progress with therapy. Also, to meet admission criteria, a patient has to need and be able to participate in up to 3 hours per day of therapy. Long-term acute care hospitals only consider patients with complex medical needs. In addition to physical rehab, some patients could need multiple IV antibiotics, frequent respiratory intervention, or complicated wound care. These facilities require approximately a 3-week stay. Total joint replacement patients generally do not meet this admission criteria. As you can see, there are many options for your post-op recovery from a total joint replacement. This is why we feel it is important to be in touch with a case manager prior to surgery to discuss your needs and what will best suit your recovery plan. Thank you for taking time to watch this video. Please do not hesitate to reach out to anyone on your team at BIDMC if you have additional questions or concerns. I wish you the very best with your joint replacement surgery.